The government of Botswana has reported its first suspected case of coronavirus. A health ministry statement says that the suspected case was registered at the Seretse Khama International Airport. Now, the suspected carrier flew in from China using Ethiopian Airways and has been isolated as investigations continue. The ministry has advised travellers to practice good hygiene and avoid affected and crowded places. They must ensure that they are screened at points of entry. For a little bit more on this, we're now joined on the line by Dr. Malaki Tshipayagae, Botswana's Director of Health Services in the Ministry of Health. Thank you very much indeed for joining us. How much do we know about this person that's being monitored regarding coronavirus?
Thank you for having me. This person came in yesterday afternoon by the Seretse airline, and upon entry and following the general screening guidelines, he was noted to have some symptoms, and subsequently on travel history, he was quarantined. Currently, the patient is undergoing investigations and is quarantined until is confirmed whether or not the patient does have coronavirus.
All right. So his quarantining is based on his travel history, but he's not symptomatic.
He did have some symptoms. He had some sore throat and others. So on the basis of travel history and the symptoms, he was quarantined.
All right. So is Botswana confident that it's able to manage if the coronavirus does in fact arrive in the country?
You can never say you are confident. However, our public health response system is trying its best to combat the potential spread of coronavirus in the country. As of now, what we have done as a country, which has been an ongoing process of public health emergency preparedness, was to train rapid response teams nationwide. And so far, we have activated them. And we are doing the retrainings and hopefully in the near future simulations so that early case identification can be done to ensure that there is no unnecessary exposure to the rest of the population.
All right, talking about exposure to the rest of the population, let's start with this flight to the Ethiopian Airline. Was this a direct flight from Ethiopia into Botswana?
Yes, this is a flight that actually goes through Vic Falls prior to landing here.
All right, and does it lands in Vic Falls, drops off passengers, picks up others, and then goes to Botswana?
Yes.
All right, so if this person who you have quarantined must have sat next to other passengers, what are you doing about them?
Well, what we are actually doing now is contact tracing, and we have actually put in an advisory that anyone with recent travel history, especially to the affected areas, to seek medical attention should they develop symptoms. However, we also requested the passenger manifest so that we can also actively trace such persons.
All right. So once you found them, what do? You also quarantine them, or will be the procedure?
For now, our quarantine is based on symptomatology. We are also aware that it's possible to have coronavirus and not show symptoms. However, currently we are, using our case identification criteria to, decide whether or not to quarantine patients.
All right, so yesterday the WHO finally said that this is a global public emergency. What sort of protocols kick in Botswana now as a result of that declaration?
Well, generally, we have decided to screen all patients through our major ports of entry. We have intensified our efforts in training healthcare workers and first responders for early case identification and isolation. And we are continuing to get appropriate materials, personal protective clothing, and so on and so forth, so that as cases arrive, or if there are any potential cases arrive, we'll be able to handle them. And from a laboratory standpoint, we are working with the WHO accredited labs in terms of sample testing.
All right. And what's the position with allowing Chinese travelers coming into the country?
Well, as you say, the WHO has noted this a public health event of international concern. Despite that, travel is not restricted. So we cannot unilaterally restrict entry of Chinese citizens into the country, let alone wherever. However, we are putting screen measures to ensure that anyone with potential of the disease is screened and isolated wherever possible.
All right, Dr. Tshipayagae, we're going to have to leave it there.